Hear a lot of misconceptions about sunscreen. They're sort of the big obvious ones. Like, I heard sunscreen causes skin cancer. And, so we're dispelling rumors like that a lot. In more recent years, there have been some concerns around health risks related to skin cancer. So, as have been reported, by your group and others, there was a lot of controversy a few years ago about bloodstream absorption of sunscreen, the chemical sunscreen components. And so there was a lot of fear around that. But, I'm always reassuring patients, these sunscreen ingredients that we've been using for decades, we have no indication that there's any risk of to human health from these very low levels in the bloodstream, but that's something else that will come up. The other thing commonly is like, well, the damage has all been done, some protection now, what's that going to do? And, sort of counseling patients that, yes, well, we can't reverse the damage of your youth. Good, some protective strategies now are going to minimize the number of skin cancers that you have moving forward. So those are some of the big ones. In terms of counseling, I think, right, it's really just about employing common sense strategies and looking beyond just applying SPF as your only level of protection. We have a lot more options now with UPF clothing, sun protective clothing, telling patients, patients who think that a baseball cap is enough for facial protection, right? Where it's not protecting anything on the sides of your face and your lower face. So broad brim hats. And I do spend time with my patients counseling about the use of sunscreen, concerned about, well, what is the best sunscreen? Which product should I be buying and using? And I always say the best product is the one you're going to wear and the one that you're going to use. And that could be different for different individuals based on your skin tone, based on, whether you're acne prone, et cetera. And so sometimes it's just a personal trial and error of different products. But I think the biggest mistakes people make are not applying with regularity. So, I tell patients every day, even in the winter. And, we do talk about cumulative exposure that, commuting, driving to work, gardening, daily activities of daily life all add up. But the other issue is if you only apply it in the summer and not the winter, it doesn't become part of your routine that you just do reflexively. So I am always encouraging that. And then I think the other common question I get is around what is the SPF level that I have to use? And counseling patients that SPF protection is nonlinear. So, I usually tell patients SPF 30 or above because, at 15, you're getting about 93 to 95% coverage. At SPF 30, it's about 97% of UVB protection. So over that, right, SPF 50, 98, it's a small incremental change. And as you go up in SPF, in order to achieve those higher levels of SPF, the product often can become less wearable, which will then have an effect on use. Yeah, and again, with the benzene levels, in terms of the risk to human health, really unsubstantiated there. And, it could be detected, but what does it mean? The aerosol products were, more of a concern. So that's a simple thing that you could counsel patients on. Just, you can avoid the spray sunscreens in favor of the cream-based ones or lotion-based ones. Well, I'd be remiss if I didn't mention the recent FDA approval of bemotrizinol, which is the first addition to the OTC monograph of the FDA in over 20 years. So this is big, big news. Bemotrizinol or Tinosorb is the other name. It's a chemical sunscreen that has been around in Europe and Asia for over 20 years. So it has a very good safety profile. But why it's so exciting is for the following reasons. So number one, it has broad UVA and UVB coverage in a single molecule. It is photo stable. So many of our chemical sunscreens are photolabile, so they break down while you're wearing them in the sun, whereas bemotrizinol has good durability, which means you have to apply it less often. It's cosmetically elegant, sheer wearable, and low risk of irritation. And then going back to that, concern about bloodstream absorption, because it's a larger molecule, the risk of absorption is lower too. So it's kind of hitting all the things that we look for in ideal sunscreen. So can't wait for that to come to the US market, which should be soon. That approval was just last month. So yeah, and I think I also touched on this before in terms of understanding how we can use energy-based devices to decrease skin cancer risk. That is very exciting. And, we are also making advancements in terms of skin cancer treatment. As a Mohs surgeon, I'm surgically removing skin cancers every day, but I look forward to the day when we have medical therapies that make the need for surgery less. And I think we are moving there. Our use of immunotherapy and PD-1 inhibitors, cemiplimab for squamous cell carcinoma, has really changed how we approach skin cancer, and the burgeoning use of neoadjuvant treatments for skin cancer with PD-1 inhibitors, and looking forward, to interlesional treatments and studies that are ongoing in that realm. I think it's going to really change, how we're treating skin cancers as well.